different perspectives on solving the staffing shortage crisis. Today, we're going to be hearing from Trisha Clark, who's the Vice President of Human Resources from Hills and Dales Healthcare, Darcy Donley, who is a registered nurse, and Director of Nursing at Asperius QNL Hospital, and Jeremy Cannon, who is the Vice President of Nursing Services at Kalkaska Memorial Hospital. We're going to kick things off today with Trisha, who's going to be talking about their surgical tech program. She'll put about 15 minutes into her presentation, and then we'll follow up that with Darcy and conclude with Jeremy and some Q&A. So thanks for joining, everybody. Trisha, whenever you're ready to start, we'll be happy to hear from you.
All right, can you see my screen?
Yes, thank you.
Okay, awesome. So I just wanted to share. So basically how we got here initially was we were down to one full-time surgical tech. Or actually we had two full-time surgical techs, one we had just hired and then one that had worked for us for a while. We needed multiple surgical techs. We posted our positions and we were not having anybody apply to those positions. So we started kind of looking at our options to see what else we could do to kind of obtain someone for those positions. As you all know, it's like normally a 2-year program, so it's not an easy program. Somebody can't get through that in a month or so, and we needed people now. So I reached out to, I don't know if any of you guys are familiar with Wanda Bigelow, but I reached out to Wanda Bigelow. She helped us set up the apprenticeship initially. It was a super easy process. It was not hard. Wanda is the apprenticeship manager at GST Michigan Works. And then I did put her contact information down here because she asked that I do that. She wants anybody and everybody that's interested in doing an apprenticeship to reach out to her, and she would help you with that as well. So I'll send the slide deck as well, as Darcy had said she'll send her slide deck so everybody can have this information. One of the things with the apprenticeship, it does have to be DOL approved. So that sounds really scary. And I think that's what kind of deters people from going through the process, because they're like, oh, you know, are they going to approve it? But it was a super easy process. I worked with Wanda to complete all of the necessary paperwork. There's an employer program agreement, so we had to make the agreement. And then we had to create what was called a work process schedule. And then we had to submit all of that to the DOL. The DOL had to accept it and approve it, and then we were able to start the program. So as soon as Wanda got that back, it did take some time, obviously, because nothing is super fast with that process. But once Wanda found out, she did let us know that the apprenticeship program had been approved and that we could go ahead and we could start with the program. So I just want to like share that with you guys, because I know it's like, it's a scary, everybody's like, oh, it's going to be a lot of paperwork. It's going to be a lot of work for me. But honestly, it didn't take Wanda and I, we met, I think 2 times we met for like a half an hour, and then maybe an hour to fill out like different paperwork here and there. How it works is we set up the work process schedule. So we just kind of had to figure out like what our apprenticeship approach was going to be. For us, we decided to do a competency-based apprenticeship, which was kind of nice, because then so this individual, we put them through MedCert, so they were doing schooling while they were also doing a competency-based apprenticeship for our organization. So they were actually hands-on as well. We had to come up with the term of the apprenticeship, like how long it was going to be. So it was going to be 160 hours of related instruction. The ratio of the apprentices, so the DOL only allows 1 apprentice to 1 journey worker. So we set them up, we had 1 apprentice to 1 journey worker. We actually ended up doing 2 apprentices. So we had the 2 journey workers working for us, and then we had 2 apprentices. And we have 1 more apprentice that is waiting to go through, but we're just waiting for the first 2 to complete the program. They're almost done. Then we had to set up an apprentice wage schedule, which was super easy. It was just like, okay, once they've completed this many competency, or at the very initial, we're going to pay them this. Then once they've completed 20 competencies, we're going to pay them this. After they complete all the competencies, we're going to pay them this. Everybody that goes through the apprenticeship program has a probationary period. So they have a 500-hour probationary period. I kind of just put out here because I don't know, has anybody that's out there, has anybody gone through this or had an apprentice themselves? Okay, so this is kind of what the work process schedule looked like. We came up with a job description, And then we went through and we created, these were actually, Wanda had created these for me. She already had, I think, a layout, but and then she had me take a look at it and make sure that I felt that it would work for our organization. But these are the competencies that had to be completed throughout the course of the year. And then while the individuals going through the competencies, they also had to go, like I said, they were going to school through med-certs. So that was the one that we decided to go with, but there's other options out there. You don't have to go with med-certs. There's other options, like depending on if they offer the program. And so Wanda would kind of walk through that process with you. So initially for the selection process, you can do internal candidates, you can do external candidates. It doesn't have to be an internal candidate if you don't have anybody internally. In our scenario, we did have actually 2 internal candidates that were interested, and then our third one that we're putting through was an internal candidate, which was super exciting because we got to promote from within. We started out with the job posting, so we just let everybody know that, hey, we're doing this apprenticeship. If you're interested in it, please let HR know. We had to make sure that they fit the qualifications. And then, which were, I mean, like high school diploma, so there wasn't a lot of different qualifications that they had to fit for this specific position. And then, we did the candidate selection. So one of the things is the DOL does require that you go through a process. You have to go through like an interviewing process to make sure that they're going to be a good fit for the apprenticeship. So, and then we offered the employment. So during the process, because I know, again, everybody's like, oh, it seems like a lot of work. I don't know that that would work for our organization. All of our HR people are extremely busy. We don't have time, but it's super easy. They give you this app. It's called WorkCans, and you can go in and they track their hours. So the employee actually goes in, they track their hours, and then the supervisor comes behind and then says, yes, they've completed these competencies. So once they've completed all of their hours, completed all the competencies, and finished the med-certs program, then they're completed with the apprenticeship. Oops. So does anybody have any questions about that process or how that works? I mean, does anybody think that they would be interested in having an apprenticeship? I don't know if we have anybody. Do we have anybody from healthcare right now, Amanda?
Yes, everyone on the line is.
Okay. So, well, yeah, well, I wasn't sure if there was like anybody from like hospital organizations, but you can do any, like, it's not just a surgical tech program. You can basically do anything. I had just reached out to Wanda recently and I told her that we'd like to do like an MLT, and she said, oh yeah, absolutely. So she had sent me the paperwork for that. We have not started that program here at Hills and Dales, but it is something that you guys, you know, just as you're looking at it, if there's something that you like, you could do the CMA, you could do a CNA. There's a lot of different options with this program. So, okay, if there's no additional questions, then I'll hand it back to Amanda. We can't hear you, Amanda. You're on mute.
Sorry, I thought my thing clicked. So thank you. So next I think we have is Darcy. If Darcy would like to go ahead and share her screen, we'd be happy to start your portion, Darcy.
Sure. It looks like I'm getting a notice that the other person might need to stop. Okay, let's try this now. Okay. I tried to have a little bit of fun here on Halloween. Well, thank you very much for having me present today. I'm going to talk a little bit about nursing pipeline development, some internships, cross-training, and new graduates. I'm Darcy Donnelly. I'm the Director of Nursing for Aspirus Keweenaw Hospital. And just a little bit about Aspirus Keweenaw. We are the northernmost hospital in the state of Michigan. And to give you a sense of where we are at related to other areas. We're 4.5 hours from the Mackinac Bridge. It's 8 or 9 hours to Lansing, Grand Rapids, or Detroit. And we're about 3.5 hours from Green Bay. So when it's football season, we have a lot of Green Bay and Lions fans that go head to head. But it's very nice to have that connection to our Wisconsin partners. Up in the corner, you can see the Aspirus network. We extend all the way from Aspirus Keweenaw all the way down to Portage, Wisconsin. And we do have our tertiary hospital in the Wausau area. We're a 25-bed critical access hospital, providing many services. We have an OB department and surgery, outpatient and inpatient. We've had 71 swing bed days this month, so a very robust swing bed program, as well as our ED 5-bed ICU and med-surg services. We are a recreational destination for many travelers, snowmobilers in the winter, and backwoods skiing. We also have mountain bikers that go up to Copper Harbor in the summertime. We're on the way to the Porcupine Mountains and hiking, fishing, and camping. We also have 2 local colleges, universities in the area, which really lends itself well to our pipeline development. We have a community college with an ADM program, and then Michigan Tech University assumed the BSN program from Finlandia University this year. So pre-pandemic, many of us were in a similar environment. We were doing primary nursing. One thing we do have here at our hospital is double occupancy beds on med-surg, which of course during the pandemic really created a difficulty in capacity because we had to separate patients out due to the COVID isolation. And we do have one CNA that floats 24/7 in-house, and that CNA goes to all departments. We do some cross training with our CNA staff as well as our nursing staff. But for this presentation, I'm going to concentrate more on the RN staff. During the pandemic, we continued that primary nursing, but of course recognized that we needed to evolve and be innovative as we were seeing nurses retire, nurses get exhausted. And so post-pandemic here, we were looking at team nursing last year, looking at how to incorporate an LPN model, and developed a nurse intern and nurse tech program. And I'll talk a little bit about our evolution over the last year. So we knew that we wanted to capture as many people early in their career as possible. And that really led to us looking at the nurse internship program. And because of the change in learning styles through the pandemic, we also recognize that the new nurses coming out of their educational institution didn't necessarily have that same clinical skill as the students had prior to the pandemic, but also the hospital environment had increased in acuity. And so that gap between graduating from school and getting into the workforce just seemed like it was getting to be a bigger and bigger chasm that we had to cross. So we were wanting to link students with more clinical opportunities and tried to create some conversations where they could have some critical thinking exercises so that they could be as experienced as possible entering into the workforce as a new nurse. Short term, we wanted to infuse our hospital with as many students and interns as possible. We knew that we were going to lose a couple new grad nurses to our competition that is only 12 to 15 miles away. But we wanted to have a really wide umbrella to expose new nurses to our environment. And then we were hoping to capture them with our cultural experience. So as we looked for the workforce development, the nurse intern program was developed. So the nurse intern can apply as a nursing student. So we're looking at those nursing students who have 1 year to go. And it's typically in the summertime that they want to apply for this nurse internship. We do regular interviews with the nurse manager. We're trying to incorporate staff, frontline staff, into our interviews for this upcoming year so they can help pick their newest teammates. That's the vision anyway, is that they'll be in from the very beginning in selecting their new teammates. And the nurse internship is a 10-week program where we tailor it to their interest. It started as a 10-week med-surg internship, primarily on day shift. 8 hours a day. We try to work them about 32 hours a week, and we paid them about $15 or $16 an hour. And it has morphed into, having a conversation and saying, what experience would you like to get? Do you think that you're going to want to be in the surgery area? Would you like a robust OB experience? How about critical care? Let's get you in there. And then 5 weeks of the program are on day shift, and 5 weeks of the program are on night shift, so that they can see the differences and also get exposed to the different environments we have within our facility. Now, what I'm hoping to move toward in the upcoming year is we have 4 Aspirus critical access hospitals in the Western UP. And I've been talking to our nursing students this year about having a multi-site experience. So if they want to travel to Iron River, to Ironwood, or to Ontonagon, they can get that Frontier Hospital experience in Ontonagon. They can get a similar experience in Ironwood, but they do have a higher volume emergency department than we do. Or Iron River is a really great swing bed hospital, bread and butter experience, and they could travel between. So we're looking at how we can develop those recruitment opportunities, per se, across the region. When the nurse internship is complete at the end of those 10 weeks, they can choose to transition into a nurse tech position. So this is, it continues to be working with an RN with limited skills, and they can continue to learn that RN role outside of their clinical rotations. So typically what we're seeing is the nurse tech is going to school. They're doing their clinical rotations with their instructors, and then they're working maybe 1 to 2 8-hour shifts a week. And they're gaining kind of the, here's the reality of what nursing is outside of that educational experience. So they get to practice the skills that they've learned in their clinical rotations and partner with that RN who, again, potentially is going to be their teammate in the future. In the ADN program that we're connected with, after the first year of schooling, they can be eligible for their LPN and sit for their LPN licensure. This is really where we were developing last year in trying to get an RN, LPN, CNA team model going, and that really hasn't come to fruition. We're seeing that this nurse tech role is really developing our nursing students in a great way, and they're transitioning into their RN role at a little bit higher level, rather than having them work in an LPN capacity, which sometimes ends up being more in a CNA capacity. If you can understand that a little bit, we're just not using them to their fullest licensure. The nurse tech 2 is really what we used to call the grad nurse. So they've completed their schooling, their formal schooling. They're waiting to take their NCLEX, and they can start their RN orientation. What we're seeing now with the NCLEX is they can complete their schooling, register for the NCLEX, and have a passing score within about 2 to 3 weeks. So the transition into this role really isn't worth the wait at this point, because they transition into the RN role so quickly that there isn't really a whole lot of time in this position to get them transferred from the HR standpoint, get them into a different pay grade, and all of those details. So it's interesting learning from that standpoint. And then in the nurse residency, this is where you have your new nurse. they're employed, they've started their orientation, and within 6 months, they get registered into a 6-month nurse residency program. This nurse residency looks at, advance my slides here, going into some health stream modules. They're doing some case studies. They are looking at scenarios that maybe they haven't encountered before, and having some conversations with that virtual classroom and during their in-person learning events to continue developing in their critical thinking. And as a Spirus-wide organization, we have facilitator guides that have been rolled out to each of our facilities so that our frontline staff or educators looking for professional development opportunities can practice their own professional development as a facilitator with the nurse residency. They can share their experience of being a nurse with the newer nurses, and they have that opportunity to debrief with them, really look at how they can be supportive. And these individuals tend to also be more engaged as preceptors as they become integrated with the nurse residency facilitation approach. So this nurse residency is once a month. It's 4 hours in the morning, so it does create a little bit of a scheduling challenge for those night shift folks, but we work around that. And then at the end of the 4 hours, they have some information that they can now go and practice with before they get to the new content in the next month. So I'm going to go back a slide and just look at kind of our advancement in the nursing workforce pathway. You can see that we've developed, these are our tip sheets. So as we develop different tip sheets, this is our standard branding. Managers now have a how-to document where they can see the mechanics of moving someone through our HR system, through our application system. When do you need to interview? When do you not need to interview? And then all of the wages that go along with that, and their roles and tasks that are associated with each role. The nurse internship program now has guidelines. We can do a one-on-one nurse internship, or we can do a cohort nurse internship. And we're trying to meet those students where they're at in their clinical advancement through school. So not only can we hire them in the summertime, but we can now hire them during their semester if it works for them, or as their semester curriculum changes, they may have an opportunity now to enter into the nurse internship more in a one-on-one capacity, rather than the cohort that is kind of our summer cohort where we have 4 to 6 nurse interns in the hospital at once. New this year is our critical care residency. We have had the most wonderful opportunity to hire new graduates into critical care. We specifically looked at individuals who had experience in a critical care area. And I can speak to 2 of our individuals. So one of our new grad nurses had been a paramedic prior to going to nursing school. So she was primed to get into a critical care position, and we hired her as a new grad into the emergency department. And then we have another individual who went through their nursing curriculum down in the Detroit area and spent some time at Beaumont and Henry Ford and in a standalone emergency department, where that's much more high volume than what we see in our emergency department. So he was able to take a full-time position in our intensive care unit, and he'll cross-train to our emergency department as a new grad. So those are a couple wins that we were excited to have some individuals who kind of met our foundational criteria for looking for this opportunity. As we've hired those individuals, our critical care residency developed programmatically. Again, we're looking at e-learning through our HealthStream platform. We have 30 nurses enrolled across the system, and feedback we've gotten from those 30 nurses are that the content is challenging, but very comprehensible, and they are able to incorporate 100% of that content into their practice. These are self-learning modules, so they have 6 months to complete them. They're able to do that during some downtime or at home, which we will pay for that if they're doing things at home, but they could work through it one module at a time. And it's categorized in systems. So there's a cardiac system module, a respiratory system module, et cetera, et cetera. There is live classroom paired with that. There's 5 classes, 6 hours a piece. Again, we look at scheduling. It focuses on critical thinking and decision-making, skills practice, simulations, and debriefings. And we are looking at a partnership between Spirus Keweenaw and Michigan Tech's Sim Lab to bring more of our simulation work to life, and hopefully being able to offer this to students prior to graduation to start working into a critical care area if they feel that they want to participate in that. Again, if they're nurse interns and then they sign on with us as a nurse tech, they're already employed with us and we could get them routed to this critical care residency prior to graduation. So some challenges and lessons learned. Upskilling during the pandemic, of course, created capacity for many roles to be created. We tried with that LPN role to see how that would fit, and it just isn't really seeming to fit in our current environment. We're needing that RN skill set more often than we're needing the LPN skill set in the acute care arena. The cultural acceptance of these roles really took some socialization. Our staff nurses needed to understand that we needed to be flexible. There are different things each of these groups can do. So if you're a nurse on the floor, you need to understand, what can a nurse intern do? What can a nurse tech do? What does that nursing student that's with their clinical instructor, what can they do? And that can change throughout the day. So our whole staffing complement has become more flexible in identifying what roles can be used to support that care. Frequent reevaluation is needed. We're looking at our programs about every 3 to 6 months, seeing if we need to shift anything. Definitely looking at all of these opportunities from a recruitment standpoint and a development partnership with our community, and how can we support the educational institutions that are trying to really develop our workforce prior to them getting into our environment. We rely on trusted practices like rounding and safety huddles to communicate any changes in our programs, and we're engaging the team along the way, just following that plan, do, study, act cycle so that they can see how we're thinking about it, and then they can provide feedback on how things are going on the floor as well. One more comment about cross-training. We do, in our interview process, we set the expectation that every RN is cross-trained to at least one other department. And so they get introduced into their first role for about a year, and then we start setting them up for success with their secondary role. And that critical care residency has allowed us to have a really smooth transition, either from med-surg into ICU, or from an ICU into an emergency department cross-training, so that as we continue to develop those tools, we really feel supported in providing that curriculum to our employees. So I will stop there. Happy to take any questions, or if you want to shout to me afterwards, happy to talk more about it.
Thanks, Darcy. Does anyone have any questions for Darcy before we move on with Jeremy?
I love that, Darcy. And this is Heather. I told Brad he needs to reach out to you. So be looking forward to Brad, either a call or an email, I'm sure, but that's a great job. I love it.
Thank you. We're also looking at, next on my list is development of a CNA certification program to help our community partners and long-term care facilities so that we can move patients out of our hospital if we can help provide those clinical sites for CNA. So, Jeremy, I see your hands up.
Yeah, thank you. Yeah, I was just I have an interest in the residency chunk of it. Do you have who does somebody manage that? Like, do you have an educator that manages that? Is that a preceptor? Like, how does that once they have that post-licensure employment and you're really kind of helping them through that first 6 months of becoming an RN, like how does that come together as far as structure?
Sure. Well, we are blessed at the moment to have other duties as assigned. So we do not currently have a clinical educator. That position has been eliminated here locally, but we do have a clinical educator that supports our UP region, our 4 hospitals. And then we look to on-site resources to coordinate the on-site work. So from a regional standpoint, I have a binder with instructions, facilitator guides, and a list of materials. I take a look at each month's curriculum and I try to reach out to subject matter experts. So the 4-hour training that's going on the 8th of November, I have a facilitator who's really good at debriefing. She's actually part of our critical incident command debriefing team. She's going to come in and debrief with them. And then I have one of our EMTs and emergency managers is going to go through the code scenario. And then my nursing supervisor that works in the ED is going to go through chest tubes with them. So we try to pair things up in that way. If our clinical educator for the region is able to come on site, she will facilitate it on that day, but otherwise we're kind of piecing that together and getting a good opportunity to provide as much as we can.
No, it's great. I think, the pre-licensure mentoring and development is, that's like one chapter of a book. And then, the post-licensure is a whole nother ball game. So the fact that you've been able to kind of look at both ends of it and develop something very successful is pretty incredible. So kudos to you and your team.
Thank you.
All right, thank you, Darcy. Up next, we have Jeremy Cannon. Jeremy will be speaking about assisting nursing students in their transition to licensed professionals.
All right, great. Let me go ahead and figure out what I'm doing here. I think, oh, here we go. Can you see my screen? Oh, if I hit share, you can see my screen probably.
Perfect.
All right,
Yep.
cool.
Got it.
All right, awesome. Thank you so much. So my name is Jeremy Cannon. I'm the Chief Nursing Officer at Kalkaska Memorial Health Center. We are about 30 miles east of Munson Medical Center in Traverse City. We're an affiliate of Munson Healthcare, but we are independent municipal hospital, critical access, and really just an awesome kind of place. So I'm going to talk a little bit about, very similar to Darcy, about growing your own rural nurse pipeline. We took maybe a little bit different avenue, but I think you'll find a lot of similarities in our content. So Critical Access Hospital, we see about just over 16,500 patients a year in our emergency department. So pretty robust ED for our location. We have a 104-bed long-term care facility. We have 2 OR suites. We are 8 licensed inpatient beds. And we're seeing growth in all service areas. So I've been in my role since February of 2020. I showed up and like 2 weeks later, the pandemic happened. And so prior to this, I worked at the Regional Referral Center. Didn't know a whole lot about rural healthcare, but I am a certified UPER, born and raised in the Upper Peninsula, and did everything they tell you not to do and moved below the bridge post-graduation. So, but we have, all of our service lines are growing. When the pandemic happened, it's a lot of uncertainty. I didn't know what was going to happen. They've been talking about the nursing crisis the entire time while I was in college. And then it just kind of exacerbated it. We saw, lots of different roles, diminish in their overall staffing numbers. And it's like, man, we need to come up with kind of a plan. So throughout the pandemic, part of our strategy, because we're flexible and nimble like most critical access hospitals, we were kind of foot on the gas the whole time. And because of that, we've seen service area growth in all of these different spaces. And in fact, we're building a brand new emergency department right now that is set to open in less than a month. We go from 7-bed ED to an 11-bed ED, and we're going to more private space in our acute care spot. So, with that was a long-term strategy. And it's like, in order to be able to meet the demands, you need to be able to have the staff to kind of follow that. And so that's how this whole thing kind of started. When I got here, I didn't have, like I said, I didn't have a ton of experience with rural healthcare, but, I am definitely rural to the core. And, just wanted to kind of position everybody to be successful. I didn't really know that critical access hospitals could be a place for professional growth. Had no idea. I did my clinical studies at I went to Northern Michigan University, and I just went right over to Marquette, and that's where I did everything. Even though there's rural facilities all over the place, everything was done in Marquette, all the experiences, and I understood why that existed and like why it was done that way. But when I got here, I realized, man, we are primed to really help people be successful, to really help grow people and give them an opportunity to care for people in their backyards. So when we look at rural recruitment, these are not, any of the stuff on here is not a secret. There was a lack of a pipeline for entry level caregivers and RNs into an organization. There's a more the market is more competitive than it's ever been. I mean, hospitals are now competing with restaurants, are competing with retail, are competing with everybody because salaries and wages have gone up. So it's just a very obviously competitive market. Burnout definitely exists. Healthcare is hard. Healthcare was hard before the pandemic, and then healthcare was really hard during the pandemic. And then overall, just perception. There's a lot of perceptions that rural healthcare and rural spaces are like Band-Aid stations, that they don't offer robust services. And that's, I think part of those rumors are started by people from rural healthcare to keep, snobby urban people out. But the reality is like it is, there's a perception. And as a student, you didn't know any better, or as a new, somebody that's naive to healthcare, you didn't know anything about rural healthcare. You just know that if you're in this big building with a big shiny letter on the front, that you're probably in the right spot. So, we took all those things and recognized that those were challenges that were kind of against us when it came to recruiting into our rural facility. But what I recognized immediately once I got here is opportunities. And one of the biggest opportunities, and every time I get an opportunity to talk to students or anybody, I talk about culture. Culture matters. It's super important. And, our culture here in Kalkaska is phenomenal. We just had our employee engagement scores done about a month and a half ago. We have just over 600 employees, and our employee engagement scores were at 92%. 92% of people agreed that this is a great place to work. I've never seen anything above 90 in my life. I've barely seen into the 80s up to now, but it's it's real. We had over 400 people participate. So culture matters. Prior to this, I worked at my first management leadership job was a gynecological oncology / urology floor. Like no nurse has ever gone to school and said, I can't wait to do that. But we had the lowest turnover, the highest patient satisfaction. We had the highest employee satisfaction, lowest number of patient complaints, and it was all because we had this excellent culture. People were able to do what they went to school for, care for people in their most vulnerable moments, and have that support that they needed to do that. And so we really have fostered that exact same thing out here. Another thing is community care. Everyone says they're caring for the community, and I truly believe that. But when I came here and did my orientation and I did my interview, I walked through the hospital. I walked through with an individual that's been here for 20 years. And she knew every single person we walked past, and she didn't know just who they were. She knew something about them more personable, like where their daughter went to dance, what their husband did, just, things that were, you only find out if you have real genuine connections with people. Here, we're truly caring for the community. A lot of people here are related to each other. That's something else I learned about a rural facility. But, you're caring for someone's neighbor, you're caring for someone's brother, you're caring for someone's sister, and that person just happens to live, potentially right next door to you. Unlike a larger facility, you can easily kind of get mixed, in the numbers and lost in the numbers. The other thing I think that's really great about a rural facility like ours is the opportunity to teach those fundamental skills. I talk all the time about that first year of employment is really hard. That first year of employment is really hard post-graduation. When you get that licensure, it's like, okay, it's a whole nother game. As I kind of explained when Darcy was going, like it's totally different. And that fundamental skills are super, super important. And I feel like we have an opportunity to really help build on those fundamental skills. There are things that we're not going to do. We're not going to do, cardiothoracic surgery. We're not doing OB. But regardless of those disciplines, you can't get to those disciplines and those expertise or specialty care without really having a strong fundamental background or foundational background. And that's what, what we're looking to do here. The other thing about rural that I think is completely different than other spaces is the access to leadership. I mean, leaders tend to be super visible, have different kind of relationships than they do in more urban spaces. I just had a student just text me an hour before we got on here. She had a question, and she just kind of reached out, and I texted her back and was able to help kind of navigate her appropriately. I mean, those kind of things just don't happen in other facilities. So I think that those are some things that we could bring to the table to really kind of, help stir up this recruitment. So the first thing we needed, was an academic partner. And fortunately for us, not just an academic partner, but one that kind of aligns with your value system. So Kirtland Community College is about 30 miles east of us here in Kalkaska in Grayling, and they have an ADN program. I bet you probably 80% of the students there are first-time college students. 80% of them come from rural communities all over the place. Place is much smaller than Kalkaska. So I connected with their college, talked to the dean, and said, hey, this is, we're looking for an academic partner. We can offer this great experience for your students, something that I think is completely unique and different than anyone else. And here's, you have access to me. Here's the things that I can bring to the table. So the first thing I did was I met with their students, their first year students, first semester students, and I just kind of reinforced professional expectations. I don't know how many of you have been to like a high school job fair lately, or even dropped kids off of high school. Every kid's wearing sweatpants and a sweatshirt. I swear that's a thing now. I have a high school student, and that's kind of like, if you don't know, you don't know. But there is a certain level of expectation when you come into the professional world. Resumes, interviews, and really kind of building your brand. So I go to the school, I talk to them about that, and then from there, just kind of introduce myself and make myself kind of known. The other thing that we could do here in Kalkaska that I thought was a strong connection with Kirtland is we can offer clinical experiences. We have a 104-bed long-term care facility with 3 different care delivery models, super diverse. It's like, bring your students to us, we'll get them through that first semester, right? And then we have med-surg on top of that. So even some of the students can go from, a really robust experience in long-term care and slide over into the med-surg experience and get another kind of robust opportunity to be in a rural facility. And then at the end of the academic semester, the other thing that we kind of looked at was, hey, they all have to do these QSIM projects, these quality research projects. It's like, why don't you make them relevant and make them relevant to rural? So I supply them all the topics. The students are in groups, the classes are in groups of 3 or 4, and they go through and research all the topics. And then I come at the very end, the end of their semester, and just critique or give feedback and let them know they're on the right path, and kind of give them that real life, how what they just studied is, applied to kind of the profession. And so those are some things that right off the go, like I could offer Kirtland, and they loved that. They were like, yeah, this is great. Like you can come back and you help reinforce a lot of the things that we're doing, and, kind of make some real life experience here. So then what we did is we're like, okay, we're going to develop a nurse tech program here. And so it was myself, and we're fortunate enough to have an educator. Her name is Kaylee. And honestly, she deserves all of the credit in the world. Like, she's the one who kind of makes this whole thing happen. And we just kind of went on a limb. I have the support of the leadership team here. Super blessed to have a great team to work with. And they're like, we're all about experimenting. They're like, go for it. And I was like, this is why we need to do it. Here are the challenges. We're going to grow. We're competing in different markets. There's lots of hospitals, but I think this is an opportunity. So what you see here, and I'll break this all down in a few minutes, is kind of like what it looks like from student nurse. So essentially you just got into nursing school all the way to the very end when you actually are, a licensed RN. And there's some segments here in between, and I'll kind of go through those next. So we do everything kind of in reverse from the day you're going to graduate. So the day you're going to graduate, you go back 18 months. At the 18-month mark, you've just completed your first semester of clinicals. And that's what kind of makes you eligible to be a nurse tech here in Kalkaska. So what we do is, like I said, we allow you to come onto the campus, do your clinical studies here. That's all great. You get a little bit of understanding what's going on. I go and I talk about professional expectations, and then I let them know about this great experience that we have the opportunity to do. And so what we do is, the first thing is you got to check the box. You got to finish that fundamentals clinical. Then you apply online and you interview, and we kind of do that, go through all those. And then what we look to do is we hire you as after you've gone through that, if you are hired, you're hired as we call it PRN. We hire you a PRN staff, which means you don't owe us any hours. I don't owe you anything. You don't owe me anything. because we recognize that these individuals are in school. So to say like, hey, I need you 40 hours a week, or I need you 32 hours a week, or 24, whatever it might be, might not work. You know, we try to meet them where they're at. We recognize that during the winter or during the school semester, their hours are going to flex down. During the summer, their hours are going to flex up. And then what we do is we typically dump them in days or afternoons. That's just kind of how it works. What they do is it's a 50-50 expectation, we call. So 50% of your time is spent with an RN, learning critical thinking skills, the flow of the department, you know, how this kind of all comes together. The other 50% is spent in an entry level role, or a role that you already have a skill for. So it could be an MA, could be an EMT, could be a CNA, could be whatever. And so that's kind of what we do. There's other, I'll get into the next one here in a minute. The next slide, I'll talk a little bit more about that. But essentially what we do is create this 50-50 expectation. Between 18 months and 9 months of graduation, we really leverage our opportunity to use our long-term care. So what we have in long-term care is 3 care delivery models. We have memory care, we have aging in place, and then we have short stay rehab. The short stay rehab is great. It's people that are, you know, just a little bit, they're too sick to go home and too well to stay in the hospital. So we kind of fill that niche. They're here for what, between 7 and 20 days. And so that's where we put a lot of our nurse techs. It's a great learning environment. There's turnover of patients, but it's a very controlled environment. So what we do with the students, again, we work collaboratively with them to create a schedule that's 8 weeks long, flexes up, like we said, during the school year or when they have time, or flexes up during the summer, down during the school year. Then we have everybody has to have at bare minimum at least a CNA license. If you have if you're a MA, great, we'll put you over with our primary care clinic. If you have an EMT license, we'll get you with our paramedics. If you have any of that stuff, you know, we'll put you in those spaces. If you come with no experience at all, we put you through the CNA course. Again, 50% with the RN actively learning, reinforcing the skills that you've learned in your clinical studies, and then 50% of the time is spent doing a support function. That could be a CNA, could be employee health, could be something clerical, could be whatever it is. And the reason we really like that, one, is it fills a gap. You know, we all have struggles with our entry-level positions, but it also allows the person to understand that healthcare is a team, and there's upstream and downstream impact to care. And so by doing this and giving that 50% experience, they have a whole nother appreciation. Because I've been a nurse at the bedside and worked with other nurses that are like, that's not a nurse job, that's a CNA job. And like that kind of stuff drives me absolutely bonkers. And so what we do is try to give that, you know, big picture perspective to them. So like I said, between 18 months, so after that first semester of clinicals to 9 months to graduation is where we fit the students in there. Then between 9 months and 3 months, we really leverage long-term care in our med-surg space. Again, med-surg, you know, we're seeing an increase in our population there. Just give them a different kind of clinical experience. And we do this purposefully, and I'll kind of talk about the reason why we go long-term care, med-surg, and so on and so forth. Just kind of follows the continuum of care. So between 3 months and graduation, what we're doing is we're working on preparing you for graduation and entering the workforce. We simultaneously also allow you to kind of go into these specialty areas. So the ED, operating room, and then we also use assisted living because you're allowed to pass meds in assisted living without being a licensed professional. So that's just kind of gives you a little bit more experience with that. So we do it kind of this way though, because it kind of works, like I said, works backwards. Typically individuals that come from the OR or the ED are going to med-surg. For med-surg, or acute care, you end up going into long-term care. So now you've seen the continuum of care, at least from a critical access perspective and Kalkaska Memorial Health Center's perspective. And so you have a kind of a full appreciation for everything that we're doing. When we get to that last little bit, we do not require anybody to, like when they become a nurse tech, we don't require them to sign a commitment to work with us. I figure after 18 months, if I haven't convinced you that this is a great culture, a great place to work, like I'm probably not going to do that. And so what we do in the last little bit monthly, we meet. The first month is talk about like what opportunities are there to improve, like what can we do better, like what would make this better for your peers, because the people coming behind you are the people that are going to be caring for you in the near future. Then we talk about the state of healthcare. We talk about, what to look for in an employer, like what's actually going on out there, things to kind of be aware of. And then we provide a job offer. It's like, here's the offer. Like, this is what it looks like. We're about being fair and equitable. And, you got it. Here's what it is. And if you want to compare it to everybody else, I feel like we're a pretty, equitable organization. But at this point, the other thing that's interesting is many of these students have not only worked with us in this tech, but they've also done their clinical experiences at larger facilities. So they have an understanding of like what the cultures look like and the pros and cons to those as well. Then we talk about burnout. We talk about work-life balance, financials, kind of public service loan forgiveness. We talk about all of those things that kind of come next. Self-care and things you're going to have to take care of. And then we provide them an NCLEX review and prep book. And, and then we're obviously there and available. And so we started this. This was a long-term strategy, not a short-term thing. And so we just had our first cohort of people that had started from the very beginning and gone all the way through, just graduated last month, or not last month, it would have been in May. And, you just never know how it's going to play out. So I go to their last little bit and I go to their quality projects and all the students are presenting. And Kaylee, the educator that's with me, is next to me. And our two nurse techs go up to do their presentation. And I mean, they were so awesome. They did such a good job. They were so far, you could tell their confidence was there. And they were just like so much further ahead of their peers that I looked at Kaylee and I was like, I think we did it. I think we did the right thing. Like, because you just don't know. You're not really sure how to measure it, right? Both individuals graduated. Both individuals work here. One took a full-time job closer to an emergency department in her hometown, but works here PRN. The other one took a full-time ED job here. And so again, what we've seen is this growth in the students' confidence. The person that texted me earlier, I was telling you about, where she started when we first brought her on board to where she's at now is night and day. It's incredible. I'm so proud of her. We have students that are coming from all over the place. The number of applicants has definitely increased. We have people that drive past other hospitals to come here, which is pretty impressive. I mean, these students are coming from over an hour away. We do compensate them. They're paid $20 an hour to work here, so that they are compensated for their hours worked, but they can make that at any other facilities as well, or multiple jobs between here and there. So we've had an increase in the number of applicants. In fact, we had so many applicants last semester that we had actually turned some people away. We typically hire around 3 people a semester, and that way we don't over dilute the product, we call it. So what we're looking to do is we have currently at this time right now, we have 9 nurse techs in Kalkaska. So that's a pretty good bench depth. I talked about the participants being more prepared. And then, like I said, they can recognize the cultural difference between our facility. It gives them an opportunity to see, that Rural has a pathway for them. There's personable and authentic relationships that are, that are developed. And then again, just recognizing that, a critical access hospital can help them meet their professional goals. My goal would be to I want them to go and work in other rural spaces. I mean, that's important. Rural healthcare, I still truly believe, saved the American healthcare system during the pandemic. And I think, my opportunity here to bring them in here, show them what it's all about. Hopefully they go into other rural spaces. If not, they go into other spaces and they recognize like what a culture can look like. A good culture can look like this. And so I didn't know, because I didn't have any other exposure to anything differently until I got over here, and the bar has been set. So really, again, I think it's been an excellent experiment. It's not even an experiment anymore. It's just something that we do. Again, every year we kind of do a PDSA. The students that are getting ready to graduate are actually working on mentoring the students that are just getting through their first semester to give them some tips on like, hey, how to be prepared, because it is a lot. Nursing school is hard. You spend a lot of time breathing into a paper bag, but I think that, we got this mentorship. The organization's committed. We just bought an amazing sim man that is the same as the quality of the ones that they have at the colleges here. We have a sim lab that's being built in our new acute care space to help with our individuals, help them get them trained and feel comfortable and confident. And so, like I said, it just continues to get better. And I think, the other thing that we have is now we have another academic partner who's looking to mimic the exact same thing that we're doing with Kirtland Community College. They just started. We're in like the beginning steps of that relationship. So, again, it's been a great opportunity. I know all the students want to work here, and we want to try to find pathways for them. But if nothing else, I want them to, I want them to work somewhere, enjoy their career. And again, even if they take full-time jobs somewhere else, we've recognized what they want to do is kind of boomerang back, keep their foot in the door and try to wait until a full-time job comes in here. So we have that bench depth. But overall, I think it's been a great program, something that I'm super passionate about, that I'm glad that, you know, I was given the opportunity to put into place out here in Kalkaska. So with that, are there any questions? I'll go ahead and stop sharing my screen here. Awesome.
Thank you, Jeremy. As Jeremy said, are there any questions that anyone has for, whether it be Trisha, additional questions for Darcy or Jeremy at this time?
This is Mariah, and I just wanted to thank Darcy and Jeremy for sharing their experiences in opening the pipeline for nursing. A lot of great examples, and it looks like it's been very successful. So Jeremy, you had 3 that first semester, and 2 out of the 3 were hired in, correct?
Yeah, we had 2 the first semester and 2 were hired in because we just started. So we were really, you know, kind of like, all right, go for a ride with us here. This is what we're looking to do. And then we haven't really promoted this. It's all been like self-promotion, which is why it's kind of really, I mean, it's no secret. The 2 students that have done well, you know, and to see how where they started, their peers are with them the whole time and kind of where they've grown. The professors see it. They really promote it. And then, so yeah, we started with 2, they graduated. Then we got 3, and then last semester we had more applicants than we could take on. And so we ended up with 3. So we have a full depth of 9 right now, 3 graduating here in 3 that are graduating in December, and 2 of the 3 are going to take jobs with us for sure. The third one is still kind of on the fence about what she wants to do, which is totally fine, you know. But I know 2 of them want to work here, and you know, have sent many messages about the authentic relationships and the development and everything else. You know, where we were missing the boat before was larger facilities were getting the opportunity, and I was part of that because I was at a larger facility, but getting to recruit people right before they graduated. And so rural hospitals were not getting any opportunity to kind of get their foot in front. Like, you know, they've been getting recruited for the last, you know, 2 or 3 semesters at a larger facility, and, you know, a facility like Kalkaska was kind of left out. So by getting in the front end and then kind of, you know, showing what we're all about, like I'm not anyone different today than I was, you know, a year ago, or what I'm going to be a year from today. And, you know, giving them opportunity to see what it's all about, that kind of just recruited itself. And then that way, you know, at least when they went to their larger facilities, like they recognized, you know, there was cultural differences, and that there was more than one player available for a job post-graduation.
I agree. I think the culture of the rural communities is a selling point. There's definitely that family atmosphere that I think is a great selling point, and that work-life balance. One thing that I found that was interesting too is you said that you pay them $20 an hour to work. That's a very competitive wage.
Yep. Yeah, it competes with, you know, everybody as far as locally, it's what everybody in the region is paying. So, you know, but it also does help fill a gap, right? Like, I mean, I don't know how many people on here have long-term cares, but like having an abundance of CNAs is not easy either. Or having, you know, or just the overall sometimes assistance, you know, clerical assistance or whatever else it is. So, you know, they're getting some training, but they're also it's advantageous to us because they're helping fill a gap. Like, we still need to have, you know, I mean, every nurse knows a strong nursing assistant or a strong CNA makes or breaks the whole thing. So we're able to bring these people in to make sure that we're not running short. The quality of care stays to the level that we expect. And yeah, the wage is you know, competitive to market for those entry-level positions.
So that $20, just for curiosity, that wage, is that for the 50% of the time when they're working in their scope, or the full 100% when they're 50% working in their scope and 50% working with the RN, gaining some clinical critical thinking skills?
Yeah, we have it set so they make the $20 when they're doing their when they are doing the nurse tech piece. They actually can make more money as a CNA. It's long-term care offers, there's oh, what is it called? The direct care worker stipend. So when it's all said and done, they actually can make more money as a CNA. Plus, they can work overtime and everything else as a CNA. And so the 20 is kind of the baseline. For the most part, that kind of fits them into whatever job they're going to be in. But if they have the opportunity to make more money in a different role because they get shift differential or whatever else it might be, like in a CNA space, you know, we don't keep them at the 20. We pay them to the level that we would everybody else that's in that role.
Yeah. I just was curious. Thank you.
You're welcome.
All right, well, I wanted to thank everyone for joining this afternoon. My apologies for the initial Zoom link not working. We'll look into see why that occurred. I will go ahead and upload this video here within the next couple of days and also supply you with the PowerPoint presentations. If you have any questions, please feel free to reach out to me, Jeremy, Darcy, or Trisha, as I'm sure we'd all like more information on what they've got doing in their hospitals and facilities. So thanks again, everybody, and have a great Halloween.